Oh, I'm with Professor Cara Nelson over at Berkeley in her office where she's teaching people in person. And we got together to talk about what has gone on since her Waterpalooza 2020 presentation on her wastewater treatment. And so, without further ado, uh, can you inform us how things are going and what? Well, I'll then ask you about the future, but
Sure
past and
thing.
present would be good.
Absolutely. Thanks for the introduction, Dennis, and great to see you all at Waterpalooza again this year. So when I talked last December, it was about this program we had launched to monitor SARS-CoV-2, the virus that causes COVID, in wastewater. And so since last September, so over a year now, we've been running a program where we monitor the concentration of the virus in wastewater all around the Central and North Bay Area. And it has turned out to be an incredibly useful tool for tracking the occurrence of COVID in our populations. And it's not just our group that's doing this. There are groups all around California and across the country that have been doing this. And the consensus is it absolutely works. I mean, it's incredible to have such a rich set of data that provides insight into how COVID is spreading in our populations. And so over the course of this monitoring program, we've seen the winter/holiday surge, which peaked in the wastewater sometime around the end of January in most of these locations in the Bay Area. And then the concentrations continued to go down for the next several months until they hit really low values in June. And that's when we were all celebrating. And the statewide mask mandate was lifted, and things seemed like they were, COVID was maybe going to turn into a thing of the past. But of course, that's not what happened. So late June, we started seeing increases in the concentrations in wastewater again, and that in fact ended up being kind of a predictor. We got some early warning that concentrations were starting to go up again, and then we had our summer surge start, and the wastewater concentrations and the clinical case data are very comparable, but they're also very complementary. I mean, the beautiful thing about wastewater is it provides information on infections, whether or not those individuals are getting tested. And so the public health folks that use our data tell us that, in some cases they learn about infections they didn't know about because people weren't getting tested. But even when they know that infections are out there, the wastewater data provide them with a lot more confidence that what they're seeing in the clinical case data. So like if they see clinical cases going up and the wastewater also shows that, then they are much more confident that they need to be doing something about it. And similarly, now that cases are coming down again, so the latest surge, it seems like so far in most locations, concentrations peaked around middle to end of August, and concentrations are going down now. So it's very reassuring to see that, we see that in the clinical case data. We also see that in the wastewater data.
How close throughout this period do various wastewater utilities correlate with each other? I mean,
Yeah, that's a really good question. It's kind of surprising that the overall trends are very similar, meaning that we've generally seen increases across the whole Bay Area over a similar time period, and then now we're starting to see decreases. But the concentrations that we measure in the wastewater can vary by as much as 100 times, like in the same week. So like the number of infections per 100,000 people it actually does vary dramatically across the Bay Area. And that's also really insightful information that we get from the wastewater data. And so there's quite a lot of variability, like on a weekly basis, and then just spatially. So, you know, if you were in charge of managing public health across the whole Bay Area, you know, there are definitely hot spots that you would want to be paying attention to, you know, in a particular week or over a few weeks. And then even within some counties, like in Marin County, for example, there were some hot spots in this latest surge where there were, you know, very defined infections, or sorry, very defined outbreaks that we could pinpoint with the wastewater data. So yeah, it depends on the scale at which you're sampling. So some of our sampling sites, we pick up the signal from only a few thousand people, and then some of them we're picking up the signal from a few 100,000 people.
Yeah, interesting. And you mentioned, yeah, what do they say with investment? Past performance is no indicator of future success. Um, but what does the future look like? Or at least
Well,
as far as you can.
yeah, I mean, I wish I could predict the future of the COVID pandemic. I've turned out to be
Well,
a
no, I
poor
have
predictor
to.
of that. I've learned from this pandemic, I'm sort of an eternal optimist, which is despite the fact that I'm, you know, a scientist and try to make data informed decisions. I sure hope this is over soon, but I don't know. You know, will we see another variant? Who knows?
Well, actually, I meant the future of
Yes,
this
I know what you meant.
investigatory treatment, because you mentioned
Right.
a role that the state would look to be playing in
Sure
this.
thing. Yeah, so I guess you know, related to the future of COVID, it seems like this ability to monitor wastewater to get, you know, to get information very quickly for a large number of people, and you know how much COVID is out there. This is a tool that our local public health agencies are really interested in seeing continue, and also the state. So the California Department of Public Health is investing in a laboratory that will be able to take samples and test them for SARS-CoV-2, and that's likely to become to go online in early 2022. And there are a number of research labs around the state like mine that are helping them get up to speed and bring that online. So that's going to be a really great resource for the state of California. And looking beyond COVID, you know, we don't know how much longer this pandemic is going to last, but there's definitely recognition that this tool of being able to monitor wastewater for any pathogens that are excreted in our waste, be they respiratory or enteric pathogens, that this is a tool that we want to have around for the long term. And so the state of California is collaborating and partnering with CDC. CDC has launched a national wastewater surveillance system, and they're expecting that to be a long-term investment for monitoring public health. So yeah, this really fantastic new toolbox that so many people have invested in bringing bringing to light during the COVID pandemic is probably something we're going to be relying on forever now.
I see. Any good questions I didn't ask you about?
Well, I guess that just to sort of summarize things, one of the things we talk a lot about in the wastewater industry and thinking about one water is that, you know, there's just one water, and water is a resource, wastewater is a resource, and there's all kinds of resources we can extract from wastewater. And the emergence of wastewater-based epidemiology emphasizes even one more resource that I think we haven't recognized enough in the past, and that's just information. You know, so yes, we can get water, we can recover water, we can recover energy, we can recover nutrients from wastewater. It's also a tremendously valuable resource in terms of the information that we can gather about the health of our populations that are contributing. So I think that's a new type of resource that will be we'll be recognizing a lot more explicitly in the future.
I guess it's a tough job being a wastewater is a resource skeptic these days.
Yes, hopefully, if that's your position, you will feel increasingly more marginalized.
Well, Professor Kara Nelson at Berkeley, reporting from the front, uh, and really appreciate the update from last December.
Yeah, thanks for your interest. Thanks
Oh,
for having
I
me.
mean, no, it's really great to hear because I mean, obviously wastewater is a tremendous resource, and as you mentioned, on a number of levels. So, I guess one of the nice things about a pandemic is being able to recognize this and develop this basically this asset information channel, and be part of the public health portfolio. So, thanks again.
You're very welcome.